afternoon to everyone. I am Dr. Aniban, practicing physician, consultant physician, practicing in South Kolkata. I am attached with MRI Thakuria Hospital and Iris Hospital, Bagajotin, Ganguly Bagan. I have passed my MBBS from the Medical College Kolkata, and I passed my MD exam, MD in General Medicine from National Medical College Kolkata. I am practicing for last 10 to 15 years in this region, and today's topic of discussion is understanding hypertension. This is a very interesting topic and very common topic, and you should know regarding the hypertension. Probably every one of you who are listening this program do know the cause of hypertension and what is hypertension. Let me clear one thing. The term hypertension probably we loosely use to express our high intensity anxiety or tension. But from the medical point of view, it is associated with tension. But when we use the term hypertension, it generally denotes the high blood pressure level. So our simplified topic of discussion will be the understanding the blood pressure, the high blood pressure precisely. What is the blood pressure and what is the mechanism of blood pressure? You have to know the basic principle of pressure. When the heart pumps, the blood goes to the arteries, and as the blood is a liquid, and it creates a lateral pressure over the blood vessels, and it causes a pressure, and we call it the blood pressure. We denote the blood pressure by using two parameters. One is systolic parameter and one is diastolic parameter. The systolic parameter is one. When the heart is fully contracted, the blood is in the arteries and it is creating the maximum pressure in the arterial wall. We call it the systolic blood pressure. And when the heart is relaxing completely, we call it the diastole in our medical term. And when the pressure exerted at that time, we call it the diastolic blood pressure. And both the pressure is important to us because it signifies a lot. There are some myths that the patient is very much sweating, he is having high temperament level, he is very much irritated with time, and he is feeling back pain or neck pain. So please check the blood pressure. Sometimes it really works, but most of the times it is one kind of myth, and we generally found the patient in our OPD that whenever a patient comes to us with any another ailment like pain abdomen, abdominal pain, headache, any type of infection, we measure the blood pressure and it comes to be high. Then we make the patient know that the patient is having hypertension or high blood pressure. So it is an incidental finding. And you know that the hypertension is one of the most common cause of cardiovascular mortality all over the world. And it is a silent killer because it doesn't produce any immediate symptoms. Not for a long time, but in the initial phase, most of the patients do not feel any type of discomfort for the high blood pressure. That is the main problem of pressure. It doesn't cause any type of problem. In other type of communicable disease like malaria, typhoid, dengue, COVID, you must feel something. That is, probably you are having high fever, you are having cough or loose motion or chest pain or something else which is really making you trouble, and you have to go to the physician, and physician checks you. After examination, he detects the problem and he gives you the medication, and after continuing the medications for 3 to 5 days or 6 days or 1 week, you are getting better. And the scars of the previous disease will not be there after 15 to 20 days or after 1 month. But the problem of sugar and pressure, both are the really challenging to us, uh, that they initially do not cause any problem, but multiple problems, like all organs, are involved in both the dreaded disease. So, what is the procedure of measuring the blood pressure? We generally measure the blood pressure with sphygmomanometer like instrument, and you can also get the instrument in digitally, and digital blood pressure monitoring machine is quite common in market now, and you can jolly well buy a machine and measure your blood pressure. But there is a criteria of measuring blood pressure. Whenever you are trying to measure the blood pressure, you should take at least 15-minute rates in a aerated room where the environment is calm and cool, and you should not take any tea or coffee or any type of nicotine product like cigarette within half an hour of measurement. And after sitting in a couch, and the pressure should be monitored, because the pressure is a dynamic process. It is always changing with respect of your body posture, with respect of your environment, and also your anxiety level. So the ideal method of measuring pressure is after rest, after taking rest for half an hour, without any coffee or cigarette for half an hour, and sitting posture with a blood pressure machine which is uh, titrated properly or calibrated properly with the other standard machine. It should be monitored. So the measurement should be accurate. And whenever we get a high blood pressure level in a patient, we immediately don't start any medication. We want to know whether it is a transient pressure, it is a temporary incidence, or it is a persistent incidence. Let me tell about the types of hypertension. We have generally two types of hypertension. One is called essential or primary hypertension, and when there is a primary, always there will be a secondary one, and another one is secondary hypertension. In primary hypertension, this is the gift from our ancestral. It is a genetic process, and we are having the high blood pressure after 30 or 40 years of age. And nowadays, the age limit has come down. We are getting the patient with the age of 20 years also with high blood pressure with the primary hypertension. And what is the secondary hypertension? Secondary hypertension means the hypertension or the high blood pressure probably due to any other organic cause. That is maybe due to kidney dysfunction, kidney problem, maybe due to hormonal dysfunction. And we have to know the organ dysfunction first. If we can detect the organ problem, and if we can treat the organ problem properly, then the hypertension will go. So the secondary hypertension has the opportunity of cure, but when it is a gift from our ancestor, it is very much difficult to cure. But we can prevent the increment of the hypertension, and also we can prevent the side effects of hypertension. Now, what are the cause of hypertension? One is the genetic cause, that I told you the primary hypertension where it is gifted from our ancestors, and other causes are obesity, high smoking, the inactive behavior or sedentary lifestyle. These are also the contributing factor of developing hypertension. And if the blood pressure level is systolic more than equal to 140 millimeter of mercury, and if the diastolic blood pressure is more than equal to 80 millimeter of mercury, we call it the hypertension or high blood pressure. There are various guidelines regarding the hypertension. In European Society, they have called it that when the blood pressure of systolic blood pressure is more than 120, it is a hypertension, and if the diastolic blood pressure is more than 80, it should be treated, and it should be also considered as type 1 hypertension. But at the uh, Indian perspective, we generally call it 120/80 is the ideal blood pressure. If it is high, more than high of 120/80 millimeter of mercury, it should be screened properly. And if you think that the patient is really suffering from hypertension, the medicine should be started from the very beginning. Whenever we detect a patient with hypertension, we primarily try to understand what are the other comorbidities the patient is having. There are multiple comorbidities may be associated with hypertension, like sugar, like cholesterol, triglyceride, or we call it dyslipidemic problem. There may be some kidney problem, there may be some hormonal problem also. So we do a protocol-wise examination along with some clinical investigation and medical investigation. Laboratory investigation is also done to know the type of hypertension and to start a medicine, because all medicines are not good for everyone. So please be careful about using a medicine without consulting any physician. So it may be good for your mother, but it should not be good for your equally good for your father also, and it also may not be good for you also. So proper consultation is very much needed. So don't start medication without consulting any physician for hypertension. In sometimes in our practice, we see that in any type of ailment, when the patient is not doing well, someone measured the blood pressure with the home blood pressure monitoring machine, and it found that it is high, and suddenly they got panicked and started the medication. The mother or father or sister or brother, whoever the taking the medication, takes the medicine and gave to the patient for the immediate relief. But don't do it. Even when we treat a patient and if patient says that, doctor, my blood pressure is shooting day by day, we call it, please wait for another 2 or 3 days, or please come to our chamber. We should measure the blood pressure first and then start any medication. Otherwise, you should not change the medication yourself. That is very much advisable. And what are the measures, non-pharmacological measures that can prevent the hypertension? One is the lifestyle. We should have very cool and calm lifestyle. The anxiety level should be very much low. That is very important, because anxiety or stress is a major factor for developing hypertension. And it is very easy to say that you should not be panicked or anxiety level should be low, but you should go for yoga, or you should go for medication or meditation, or any relaxing technique by using reading book or listening any music. Any type of relaxation is very much needed, because we are always under very much stress, and the stress is causing high blood pressure and cardiovascular problem. Another thing is that low salt diet is recommended. We call it DASH diet, the diet for stopping of hypertension. There should be huge amount of fruits, vegetables, and there should be less amount of saturated fatty acid food, the fried food also. The problem of hypertension is it causes the multiple organ damage. So it not only affect the your blood pressure, but it also damages all the multiple organs like heart, kidney, liver, brain, and it increases the heart attack rate at least for 10 to 15%, and it also contributes the cardiovascular risk, that is the brain stroke, for 15 to 20%. So it should be measured properly and it should be controlled. We have to manage the hypertension. First of all, by non-pharmaceutical measure. That is the lifestyle modification, which is very important in our day. First of all, we have to manage our stress level. It is very easy to say that you should not be panicked, you should not be anxious, you should be stable in all the time. But as the pressure or the problem is very much high in our brain, it is very much difficult to control our emotions and our stress. You should go for any meditation, yoga, or you can use the reading book or listening to music to overcome the stress related problem. And in the dietary regimen, you should avoid the high salt products. And in patient having the hypertension, we recommend the DASH diet. DASH means the diet for stopping hypertension, and it contains less salt, huge amount of fruits, legumes, and less amount of saturated fatty acids, fried food also. Obesity should be controlled. Obesity was the problem of Western countries, but it is now coming in India and Southeastern Asia also. And we are facing the obesity problem in huge number. Obesity should be managed properly because obesity can cause the sleep apnea. You may know the name of sleep apnea, which is also a cause of hypertension or the high blood pressure. Sedentary lifestyle is also a major factor for developing hypertension in early age. So you should be doing some exercise regularly, and that should be on a moderate basis from initial aspect, and you should escalate it for a period of time. Don't start any exercise suddenly and not more than half an hour at a time. Whenever you are accustomed with the previous exercise, then do the exercise as per your body permits. Otherwise, don't do the exercise. And if you are trying to do any weightlifting or anything, please consult your physician before starting any gym or any procedure. We generally do not advocate using any type of nutritious health supplement if the patient is not having any food, or if the patient is having suffering from a long chronic disease, then the supplements are okay. But if you are healthy, if you are taking food regularly, try to avoid the unregistered food supplement because it may cause any liver damage or kidney damage. And you should quit the smoking also. Smoking is also a major factor of cardiovascular catastrophes. You all know that. And regarding the medication, when the medicine has been started from the doctor's end, you should follow the advice and you should continue the medication, and not for the lifetime. You should go to the doctor in a regular interval to check whether the blood pressures are within normal limit or it is causing any type of other comorbidities or any other side effects or not. Whenever you are taking any medications, there are good effects and there might be some side effects. And it is advisable not to stop any type of medications without consulting your physician. There might be some side effects like you might have some leg swelling, there might be some cough, or there might be low blood pressure after taking medications. But don't stop medication. You go to your physician and tell the problem and take his advice. Without taking advice, don't stop any medication. Many a time we see that when the patient is suffering from diabetes, hypertension, or the high blood pressure, he is also suffering from many other ailments, and there are multiple medications. So make a chart that what are the medicines you are taking, and whenever you go to any professionals, the medical professional, and show him the chart first. Probably you are going to an orthopedic surgeon. He is probably not aware about regarding your hypertension and sugar level or any other comorbidity. He will give you medications that will not be applicable to the patient who is suffering from hypertension. So it is my advice doctors don't have any very much time, and there'll be huge rush and huge pressure. So you should make a daily routine, daily medical list, that I am taking this medicine in the morning or in the afternoon or in the night, and make a chart. Whatever the cause of medication is, you make a chart and go to your doctor and place the medicine chart first, to know whether there is any problem with the medicines first, or whether the doctor will prescribe any other medication after seeing the medicine you are having. And other thing is that if you are taking any medicine, there might be some other cross reactions with the other medicine. So every time you take the medicine properly, and if the patient is very old age group, you give the medicine in person, because in old age group there might be some forgetfulness, and there might some catastrophe regarding the pressure. Whenever you are going to a medical professional for measuring the blood pressure level, don't stop the medicine without consulting him. Sometimes we have seen that the patient is taking some medicine, but whenever he goes to the physician, he doesn't take the medicine at that day, because there is a false conception that if I take the medicine, the pressure will be low and doctor will change the medicine. No, you come with your proper routine and tell your doctor that I have taken the medication in the morning or evening or night also. So it is the regular process. Don't stop the medicine without consulting your doctor. It is the most important message. And the blood pressure monitoring. Should you have to go to the physician regularly on regular interval? Yes, you should have to go. But in our student age, we generally did not recommend the blood pressure monitoring at home. But nowadays, it is recommended that you should monitor your blood pressure and make a chart. And whenever you go to the doctor, go with the chart with regular blood pressure monitoring. Don't measure the blood pressure in every day, or in a day twice or thrice in a day. It will make you panicked. There will be variation of blood pressure, and you will be confused. So make it a routine that you should measure your blood pressure once in a week or once in a fortnight, and make a chart. And whenever you are going to the person of specialty, show the chart. Sometimes there is a common term called white coat hypertension. Whenever the patient goes to the doctor's chamber, there is anxiety. We call it the white coat anxiety, and the pressure goes up. And if you have the baseline at your home or the office blood pressure, that will be much convenient for the doctor to know whether the pressure is really high or not. We have also a machine called the 24 hours ambulatory blood pressure monitoring. When the blood pressure is very much fluctuating, we prescribe the patient with the 24 hours blood pressure monitoring apparatus. It is a simple machine which take the record of blood pressure 24 hours throughout the day, and by taking the average, we do know whether the patient is having the fluctuating blood pressure or there is a normal fluctuation. So it is my point of view that you should check your blood pressure on regular interval. Whenever you have the family history of high blood pressure from your father or mother, or a family history of heart disease or stroke, from the very beginning, after the age of 20 or 24 years, you should know your profile. So you should know your blood pressure on regular basis and live a healthy life. And if there is any medication for controlling blood pressure, you should take the blood pressure medicine without any fail. Be healthy and have a good life in future also. Thank you for listening this video. Thank you.